Please start.
Good morning, everybody. I'm Dr. Amogh, and my talk for today is comparison of wet lab skill training in novel mobile-based VR platform versus conventional training. I have no financial disclosures. So when we pass out of residency, the main issue that we face when we go to hospitals is that there is a certain skill set that the work demands that is not available as soon as we pass out of residency. There is a certain imbalance. So how do we bridge this gap? So what are the challenges that we face in ophthalmic surgical training? One is the high cost of microscopes, the limited training access, and generally when we go to use the wet labs, there is somebody already occupying it. So the dearth of microscope is the main issue that we face, and then the institutional constraints. So what is the solution to this? We need something that gives us immersive like-to-like training and comparable, which is comparable to conventional training. So the four tenets of virtual reality would be to create an environment that mimics the OR, operating room. Second one would be the immersiveness. Third one would be feedback. And fourth one would be the intent of the virtual reality module that you're creating. So I've named the device that I've created Varda, which is after my son, which is basically virtual augmented reality developing advanced anatomical navigation. So what we have done in this is we have taken an inexpensive virtuality headset off Amazon, which is basically 500 rupees, and we have connected a Type-C to a USB connector, connected this to your normal Android phone, which is again what we normally carry around, and we have converted into a stereoscopic image. So basically single image is converted into two images, and it gives you a stereoscopic feel, which may not be too stereopsis, but which mimics very, very close to what you get in the operating room. So what makes it novel? We have a USB camera feed integration, which is connected via USB Type-C connector. We have added a plus 10 diopter PMMA length, which is again very inexpensive. You connect it you attach it to the USB camera to reduce the working distance, and this makes it portable and cost-effective. So the study I've done has basically 20 ophthalmic surgeons, 10 beginners and 10 advanced, and we asked them to practice corneal suturing using VR and the microscope-based methods, and we measured surgical time, precision, and the surgeon feedback. So this is what we saw on comparing surgical times. It is the initial 5 minutes were given to get used to the VR headset, and then we asked them to suture, and we found no significant difference in surgical times. The advanced surgeons performed similarly, and the beginners adapted faster with VR. And then we asked them for their feedback, and we found that 80% of the participants rated the virtual reality platform as easy and very easy to use. There's a strong depth perception that was there, which is comparable to the microscopes, and there is high accessibility and affordability. This is a cost-effective alternative to expensive microscopes and can be used in wet labs. It gives a very near real experience because the plus 10 diopter lens improves the surgical precision and makes the working distance comparable. It can be taken along with you. Basically, you just have to carry the web camera and the virtual reality headset, and you can basically take it to anywhere you want. It can be, the users can be extended to squint, amblyopia. You can even record what you watch. You can actually do a virtual reality or stereoscopic recording of the, like what we do with the GoPro or a point of view cameras. Future scope would be to add AI-based feedback mechanism based on the recordings. You can actually record what you're seeing, and this can be expanded to other ophthalmic procedures. You can actually do 3D video recording, as I suggested, and do first-person view recordings and watch it later. So this is the app Facefront that we have developed, and this is a cost-effective alternative. It's accessible and it's a very good alternative to traditional wet labs. It has potential to revolutionize ophthalmic education, particularly in resource-limited settings, and make training more efficient, scalable, and globally accessible. Thank you.
Do you have a video or something? How do your patients are practicing or something? Okay, no, you should have presented here only. You had still 1 minute of time left. So anyway, nice presentation.